Welcome everyone. We will just wait until some more registrants join us and then we'll get started. So welcome everyone who's joining us from the waiting room today. We're very excited to offer you this presentation and conversations with Nadine. So we've got a few hellos in the chat. Hello everyone. Welcome everyone. It's so nice to see all your chats and good mornings. It's all very friendly. So thank you everyone. Now we have nearly 800 registrants today. So you might notice that your video and audio is switched off, and hopefully you can see a few of our panel members that are joining today. I'm noticing a couple of questions come through. So we do have Sarah who's on hand to answer some questions. So we might make a start. Welcome everyone to the Heart Foundation live panel interview, Conversations with Nadine. The Heart Foundation acknowledges the traditional owners and custodians of country throughout Australia and their continuing connection to land, waters and community. We pay our respect to them and their cultures and elders past, present and future. My name's Carlye Weiner. I'm a clinical psychologist with a special interest in chronic health and emotional wellbeing and an advocate for integrative healthcare. I'm also the host of the Heart Foundation's podcast, Supporting Young Hearts, the Heart to Heart series, shining a light on emotional health for young people living with a heart condition. I'd like to thank you all so much for joining us this morning, as well as your generous support and your time today. It's thanks to you that we're able to invest millions of dollars in cutting edge research. We're very lucky to have Professor Nadine Kasparian here with us, as well as two lovely young women, Cara and Caitlin, sharing their stories on living with heart conditions, the focus of Nadine's research, more specifically congenital heart conditions. At the Heart Foundation, we're very strategic in our research funding and our program support and develop excellence in all areas of heart research, from basic research through to clinical trials. So as you're about to hear, you really are helping to fund some truly innovative research that has the potential to save many lives and keep more families together. So a little bit of housekeeping to start. As I mentioned, we have had over 800 registrants. So you will be on mute and unable to turn on your video. Throughout the session, I invite you to start submitting your questions to our panel members via the Q&A section at the bottom of your screen there. We'll attempt to answer as many questions as possible later in the session. And I know some of you have already sent us a couple of questions prior, which is great as well. So let me briefly introduce you to our panel. Firstly, we have Professor Nadine Kasparian. So Nadine is a professor of paediatrics and the head of psychology at the Heart Centre for Children, Sydney Children's Hospital Network. With a PhD in medical psychology from the University of Sydney, she is a leader of an integrated psychological research program dedicated to congenital heart disease, the first of its kind in Australia and one of the first in the world. Then we'll have our two other panelists, both of whom have shared their stories on our podcast, and I know who have touched so many others' lives already. Caitlin and Cara both live with congenital heart disease and are here to share their stories. They'll share a little bit more with you. Caitlin is a 20-year-old university student from Sydney, and Cara is a 36-year-old from northern New South Wales who has had 5 surgeries to date, but hasn't let that stop her from travelling the world and embracing life. And we'll hear a little bit more about them in a moment. So firstly, our first panel member is Nadine, who will talk to us about her vital work and about her vision to transform mental health outcomes for people with congenital heart disease as well as their families. So I'm going to introduce Nadine a little bit further and her amazing accolades. So Nadine is a Heart Foundation Future Leader Fellow. She was awarded her fellowship in 2016 to develop strategies to improve psychological health in children and adults with congenital heart disease. In 2018 to 19, she spent a year working at Harvard Medical School after being awarded a prestigious Harkness Fellowship in Healthcare Policy and Practice. Nadine is a widely published author with over 1,110 journal articles and is a regular speaker at national and international conferences. Nadine, we're so excited to have you here. So thank you so much for joining. Tell us a little bit of an overview about your current research and why it's so important.
Oh, thank you so much, Carlye. It's wonderful to be here with you and Cara and Caitlin and our heart community. Thanks so much, everyone, for joining. We know congenital heart disease, or CHD, is one of the most common diseases babies are born with. In Australia, it affects about 1 in every 100 babies and is the most common reason newborn babies are admitted to paediatric intensive care units across the country. Over the past 40 years, we've seen really remarkable improvements in medical and surgical care for children with congenital heart disease. More children are surviving than ever before, which is a tremendous success in our field. But with these improvements, we've been able to see the broader consequences of this disease, including the ways in which it can profoundly affect mental health, not only for children and adults living with CHD, but also for their mums and dads, their siblings and other family members. And this is where our research comes in. So my team is dedicated to better understanding the factors that influence mental health outcomes for people with congenital heart disease, so the pathways to risk and resilience. And most importantly, we focus on developing new programs and treatments to ensure our patients and their families have access to the best possible mental health care at the right time and in the right place.
So wonderful, Nadine. So how does this work have the potential to improve the lives of people like Caitlin and Cara and their families?
Our research really reaches across the lifespan. So we work with babies and young children, adolescents and adults with CHD and their families, and importantly also their heart care teams. And we start our work as early as during pregnancy, when some mums and dads will first learn about their baby's heart condition through fetal cardiac diagnosis. Now, as you can imagine, hearing the words, "your baby has a heart condition," can be a devastating moment for families. And through our research, we've shown that as many as 1 in 2 mums and dads experience very high levels of anxiety in the weeks and months after their baby's diagnosis. And importantly, without any intervention, this anxiety can persist long after their baby's heart surgery. We found that some of the strongest predictors of parent mental health after diagnosis are things that we can work to change, like providing greater opportunities for parents to express their emotions and learn new ways of coping, providing information to help parents prepare and assist with decision-making, helping parents to bond with their baby during pregnancy and also while they're in hospital and at home, and supporting parents to feel empowered to partner in their baby's care. And by providing or offering these kinds of supports, we not only offer an opportunity to improve parent mental health, but also child mental health and development. And in our work with children and adults, we found that as many as 50% of people with CHD will experience anxiety or depression at some point in their life. And this can affect the things that matter most to our patients, but to all of us, our relationships, our capacity to achieve at school or at work, our sense of independence, and our overall quality of life. And we know that our mental health can really powerfully affect our physical health and vice versa. You mentioned my time at Harvard Medical School, and while I was there, I had an opportunity to study to be part of a study that included over 1,000 adults with congenital heart disease. And through this work, we found that depression and CHD was associated with a range of physical factors. So for example, people with congenital heart disease and depression had indicators, were more likely to have indicators of inflammation and heart failure, and even a higher risk of mortality. And yet there are still very few dedicated psychology programs available worldwide to prevent or minimize these kinds of effects. And our vision is to really make mental health care an ordinary, routine, everyday part of congenital heart care.
So wonderful. And you can really see the links across so many areas of the lifespan and health outcomes there too. So Nadine, you've done amazing work in this area. What inspired you to enter this field, and what makes you so passionate about working with congenital heart disease?
Oh, thank you for asking that. I have to be honest and say I never really expected to be a researcher. That wasn't something that I had imagined. But I was offered an opportunity to take up a PhD scholarship, and through that I had amazing mentors and very exciting opportunities that really fueled my passion to work in this field and to really better understand the connections between medicine and psychology and the ways in which the two fields can work together to make a big difference. And one of the early examples is a very small study that I had the privilege of working on over a decade ago now. We interviewed 53 mums and dads after their baby's diagnosis of congenital heart disease. And the evidence and the experiences that we were able to collate really profoundly changed the direction of congenital heart care in our country. We were able to take the findings of that research and share them with our heart centre, our hospital, and then at meetings across the country. And on the basis of just that one really small study, we were able to build Australia's first mental health program dedicated to childhood heart disease, and also support many other programs in their development. So, that really convinced me of the power of research to not only, uncover and discover really important findings, but also to change practice and really drive change. And that is definitely what gets me up early in the morning and keeps me very passionate about working in this area.
I can see that passion, and I can really see how your research has translated to really feasible change as well. So what's the big picture here? Where would you like to see this research go?
Oh, I think our ultimate outcome is we talk about transforming mental health outcomes in congenital heart disease. I talked earlier on about those incredible improvements in medical and surgical care, and we want to see just those same level or extent of improvement in mental health care. We want to make sure that every person with congenital heart disease and their family has the capacity to access care when they need it and how they need it, and to really track outcomes over time to better understand and discover the factors that make the most difference in terms of improving mental health outcomes and address those so that our patients and their families no longer fall through the cracks in terms of mental health care and are able to receive the support and the care that they need when they need it.
It's a wonderful vision. And so what difference has the Heart Foundation's Future Leader Fellowship funding made to your research?
Oh, a tremendous difference. I would not be able to talk about the work that I'm talking about without the support of the Heart Foundation. They have supported my program since 2017, and that means not only supporting me and my research, but also supporting a number of PhD students, a number of early career researchers to really build a workforce in this area and drive change. One of the studies that we have now been leading for the past 5 years has very carefully tracked outcomes for mums, dads, and their babies during pregnancy and across their first year of life. We've been able to collect a huge amount of mental health data, but also data on infant behaviours, infant development, and biological factors that tell us a huge amount about responses to stress, and also to look at parent-infant bonding and neurodevelopment. And we hope to be able to continue that research well into the future and use this as a foundation to better understand outcomes later on in life for these babies. And we wouldn't be able to do that work without the Heart Foundation.
You've come so far, and yet there's so much to do, isn't there?
Exactly.
Wonderful. Well, thank you, Nadine, for that overview of your amazing research. No doubt there'll be some questions for you a little bit. So I'll jump to Cara and Caitlin now, our wonderful lived experience panel. So Cara, I might start with you. Can you share a little bit about your heart journey with us in terms of your experience of congenital heart disease and how it relates to Nadine's research?
Yeah, sure. So I was born with a condition called pulmonary atresia, and I noticed Nadine mentioned earlier about how nowadays parents, like, heart conditions can be picked up. When I was born, because it was 1984, there was actually no way to tell. So when I was born, my mum actually didn't have any prior knowledge, but I've had 5 surgeries to date. So I had one at 3 days old, one at 6 days, one at 6 months, one when I was 21, and I had my 5th one about 4 years ago. And that one hasn't worked, so I'm actually due to meet with the transplant team in about 2 weeks. So yeah.
You've certainly had quite a journey, haven't you, Cara? And so has Nadine's research on looking at family, mental health and anxiety across the lifespan resonated with you? What's been your experience of mental health growing up with this?
Yeah, sure. It's actually quite funny. I didn't think that I had much mental health issues when I was younger. I think I was just young, resilient, and the way I was brought up, I was quite blessed. It didn't really stop me from doing anything. And sorry about that. And then it's only been in later years that this condition has actually caused me mental health issues. So it's been a bit hard to navigate, I guess, because I've never actually experienced that before.
Are you aware of your parents or family members being worried about you or it impacting them as you're growing up?
Yeah, sure. I actually say to Mum, now I'm old enough and sort of have a better understanding. Mum, to me, when I was growing up, Mum and Dad seemed so normal. And I've actually questioned Mum later on in life. I'm like, well, how did you, because I would be a nervous wreck. And she just said, she said she didn't, it was easier for her to just keep it all inside, and she never showed the worry to me because she didn't want that to impact, I guess, my ability of being able to do things or thinking I was different, if that makes sense.
Yep, absolutely. So how could have Nadine's research supported your family had it existed 20 years ago?
I think it probably would have helped with my mum, just probably making her feel that she's less alone, and maybe better coping strategies, maybe, I guess, just better ways to communicate, or even to communicate with doctors, because I guess as confusing as it is for me now, I'm an adult. Like when I was a kid, Mum used to go to all the doctor's appointments, and, you know, sometimes the language that they use and the information you're getting is so heavy. I think it just would have been good for her to have an outlet. Same with my dad and even my sister. Like growing up, I think it would have helped my sister, because I feel a bit guilty in a sense that there was at times when we were younger, there was so much attention on me because I was either so sick or I was having a surgery. So I feel a little bit of guilt. So because she sort of, not that she got left behind, but I just feel like it might have been good for her to have somebody to talk to as well.
Yeah. So while you have a really resilient family, that extra support and that knowledge and probably that wraparound to be able to support you, your family, your sister would be great in moving forward.
Yeah. And just even for myself, like now I'm older, I sort of understand it a bit more, but like at school and stuff, there's lots of things that come with the congenital heart condition. Like I was quite delayed at school, you know, playing sports, stuff like that. If there had been better information all round, I think it probably would have been beneficial. Because I mean, for example, at school, I struggled a lot, and it would have even been good if we had that information that we could give a heads up to my teachers, or you know, instead of I thought I was a bit of a lazy or just a little bit dumb at school. Like it's not until now that I've realised and read up on things and had information given to me that I'm like, oh, that's why I struggled with that, or that's why.
Yeah. So more awareness.
Yeah. And I think too, now that I'm like I said, all my mental health issues developed later in life. So it's only actually because I was a bit blessed and it didn't really stop me from doing anything when I was younger. It's starting to stop me now. So I've just struggled mentally, and I've had to sort of wade my way through that, because it's like this realization that, oh, I am different. And just it is starting to hold me back now. So, yeah.
Yeah. Thank you so much for sharing your story, Cara. No doubt there'll be some questions for you as well. So I'll jump to Caitlin now. And Caitlin, would you mind sharing a little bit about your heart journey with congenital heart disease?
Yeah, so I was born with a bicuspid aortic valve with valve regurgitation and a quite noticeable heart murmur. Throughout the first 18 years of my life, I grew up knowing I had CHD, but not thinking too much of it. Every time I saw my cardiologist, he was really happy with my progress. But when I was in year 12, completing my HSC, I got a new cardiologist, and they told me that my condition had become severe in the last 2 years. So over the course of the next 6 months, my life changed quite quickly. And I was suddenly told that I needed open heart surgery, which was a really big shock to me, because I'd sort of been under the impression my whole life that if I needed open heart surgery, it would be much later in life, if at all. So I was in my first semester of my uni degree. I was 18 years old, and I went down to Melbourne and I had open heart surgery. And I'm now almost 21 and recovering well. Everything's going good.
No, you have had quite the journey, Caitlin, and quite the shock when it came to your surgery. And I know mental health is pretty topical overall at the moment, but especially, you know, and I know you've been involved in raising awareness with mental health and heart conditions. What do you think of Nadine's research?
Oh, I think that Nadine's research is so amazing. It's not just that congenital heart disease, as you said, it's not just that it has an impact on the person with the heart disease, but it has massive impacts on the family as well. I know that my mum in particular was very emotional throughout my journey, and I felt like I needed to be a little bit stronger, because I knew that if I was upset, that would just make her more upset. So I know that if those sort of conversations around mental health were in place, I think it would have really helped my family and myself in getting through the journey, because it really does have such an impact on all aspects of your life, and managing that, especially when there's an element of urgency and things change really quickly, I think that would be really beneficial.
And say we achieved our goals of this integrated approach and this awareness of mental health and extra support, what would that mean to you and your family, do you think?
I think it would be great. I mean, I know that personally, One of the things that really resonated with me from Nadine's research was when she said that 50% of people with congenital heart disease will experience some form of anxiety. I found that really comforting to know, actually, because I know that I have anxiety myself, so it makes me feel a bit better knowing that that's sort of a common experience. So I think that having those mechanisms in place in order to help me deal with it would have been really, really beneficial and just helpful. You know, we're navigating, especially at a young age, we're navigating so many different areas of life. I had university, I'm trying to start work, and then going under the knife with open heart surgery. It's a lot to deal with. So having those conversations and having those mechanisms to help me cope, I think would have been really, really good.
And as you've both mentioned, it's not just in one point in time as well, it's throughout your lifespan and ups and downs happen. So it's so important that Nadine's research covers, you know, from prenatal to, you know, all throughout life as well.
Absolutely.
So yeah, thank you so much for sharing, ladies. I'll move on to the questions now. We have a question from Bill for what sounds like for Nadine. So what data do you capture in following congenital heart disease and mental health?
Oh, Bill, thank you so much for that question. We capture all types of data, and that's something that's very important to our program, that to truly and deeply understand the mental health impacts of congenital heart disease. There is no one piece of data that will answer our questions. It really is a very integrated approach where we piece together lots of pieces of the puzzle. So we collect self-report data on mental health and a range of different other psychological outcomes. We also collect data from interviews and clinical interviews. We are one of the only units in the world that carries out very detailed and comprehensive behavioural assessments with babies and their parents to better understand interactions between parents and babies early on in their developing bond, and also looking at attachment behaviours in young infants and children with congenital heart disease, to identify any difficulties that we might be able to pick up on very early on and offer, you know, preventive or early intervention strategies to minimise effects and difficulties later on down the track. We also use a range of different neurodevelopmental assessments to tap into exactly what Cara was talking about before, to better understand any learning or attention or other kinds of neurodevelopmental difficulties that young children might be experiencing, and so that we can offer a range of supports in that space as well. So lots of different types of data, Bill, whether that's through surveys or behavioural observation or interviews, or also biological samples or biospecimens. So we collect samples of blood and saliva to better understand what's happening under the skin, particularly for people who might be experiencing greater stress, and to really be able to look at that interconnection between physical and mental health in that way as well. So I hope that answers your question, Bill. I think I could talk all day about that, so I'll stop.
We've got another question from Catherine. Does the mental health issues come up on, I'm so sorry, does the mental health issues also come up on the hereditary heart conditions? It sounds like, Catherine, you've got sons with hereditary heart conditions and only one with mental health issues. So I think it's asking about mental health and congenital heart conditions.
Thanks so much for that question, Catherine. We work across the board, so I focus particularly on congenital heart disease today, but we work with children and people with all types of childhood onset heart disease, including arrhythmia conditions, genetic heart conditions, cardiomyopathies, and you're absolutely right. The mental health impacts are important across all different types of childhood onset heart disease, and And in particular, we're focused on better understanding traumatic stress and the ways in which we can buffer children and adults and families from the potential impacts of experiencing or being exposed to trauma.
Great, thank you. There's a couple of questions about treatment and how to manage anxiety and congenital heart conditions. So I might actually ask Caitlin, because I know that you've had some experience here. So how can you advise someone to manage their congenital heart condition and their anxiety?
I think it's just about finding ways to practice mindfulness. I spoke about this in the podcast. A lot of people recommend mindfulness, and I absolutely think that it is so beneficial. But personally, I find it really difficult to practice the typical mindfulness where you sort of just sit in a room and try and not think about anything. And I personally find that really difficult because I think of my anxiety. So I find different ways to calm myself down and make sure that I take the time to not only acknowledge just what I'm feeling emotionally about my condition, but also ensuring that I take the time for myself, I relax. For me, I used to do mindfulness coloring, particularly in the 6 months after my surgery. But yeah, I think it's just about finding ways to relax yourself and making sure you seek any support that you need, whether that's from friends, family, or professional support.
Wonderful advice. Thank you. So I'm very sorry. We've had lots of questions and we need to wrap up because I'm conscious of time. So I want to thank our panelists, Nadine, Cara, Caitlin, for making the time today, sharing a bit about your lives and your stories and your really important work. I want to thank everyone, all the participants here for being here and your ongoing support of the Heart Foundation. Life-saving research like Nadine's would not be possible without you. And as you can see, it has a profound effect on the lives of people living with heart disease like Cara and Caitlin, as well as their families, siblings, and broader networks as well. So for everyone joining us here today, we'll be sending you a download link to this webcast that you're welcome to share with others. Please check our website of how to support us further. And we can't thank you enough for your support. So I hope you've enjoyed our conversation with Nadine and our wonderful panel members. Thank you for joining us, and thank you so much for your time.